so much, Dr. Malad, for your presentation. That was incredible. Next up, we have another incredible guest speaker lined up. We have Dr. Mipsang Lama with us, who's joining us all the way from Nepal. So, Dr. Mipsang, the stage is all yours.
Good afternoon, everyone. Just to begin with a program, I would just like to say a few words about Rahul. Rahul was such a wonderful person, and I'm very lucky to have met him in a person and then spend some time with him. So, as Achal mentioned, 2017 he was diagnosed as a lymphoma, and then the treating physician is Professor Nair, and then we were the assisting physicians to cure his disease. He was fortunately cured of the non-Hodgkin's lymphoma, but then unfortunately we lost him. And then there has been like a kind of a pause that he was doing for this cancer patients, which was his dream. And now the Achal has stepped up in his father's her father's position, and then I'm happy to see her here. So really glad to be a part of this meeting. Initially, I was kind of a little bit hesitant to accept as a guest speaker, as I was speaking with the great personalities like Professor Nair and Professor Mohandas. But as I speak about some problems that I face every day in my clinical practice, so I just accepted to do so. My very little understanding about artificial intelligence is that it would ease a physician in a prompt and accurate diagnosis of the disease and guide us through a management without using expensive tools. It would probably save time and money of the patients. In some cases, artificial intelligence may be more sensitive in diagnosing the cases as compared to the physicians, if I'm not wrong. So it would be helpful for a person like me and also the physicians in the same scenario treating the physicians that lymphomap would be the answer for the diagnosing and treating the cases. So basically I would be sharing some problems that I face every day, like the other physicians do the same in the same setting. I would also list some various problems that I face as I joined as hemato-oncologist in Nepal. And just to share with some, the number one problem would be the consenting. As Nepal has a literacy rate very low. In about 40 to 50 years back, our literacy rate was around 20%. Now it has rose up to 60%, but then elderly age group is the literacy rate is very low. So with this, people do have a lot of faith towards the traditional healers and do have a belief in the religious belief, like let nature do the healing. But in cancer, I don't think that would be the answer for that. And another issue is like when we have these cancers, we see lumps and bumps. So after seeing that, people ask like, what are you thinking, doctor? So what we say is basically, maybe you are suffering from a cancer. The answer we get from them is like, if you are thinking of a cancer, then why do a biopsy? As it has no effective treatment at all. But we, at this point of time, probably we are facing a problem to take them to the treatment. Sometimes what they say is like, part of the body cannot be taken for examinations. So that is another problem that we do have. And once we diagnose the cancer, revealing the cancer to the patient is difficult because relatives request not to reveal the cancer to the patient. So probably this is hampering the willingness of the treatment and also the adherence to the treatment in this scenario. Second number, what I would list is we have certain problems with the diagnostic centers. As a hematologist, I would say the acute promyelocytic leukemia is one of the hematological emergency. In that case, we would be looking for a fish for 15, 17 translocation in a couple of hours, but it doesn't happen so. It would take days. So in happening so, what we do is sometimes we miss treat the patient. Sometimes we over-treat the patient, and sometimes we under-treat the patient. So that is what is happening in accurate diagnosis of the patients. So even though the diagnosis is improving day by day in our country, but then we really depend upon a lot of investigations in our neighboring countries like India, like IHC panel, immunophenotyping, stereotyping, genetic testings. These are the problems that we face every day. Third thing, the problem what I would list is a manpower. I don't know the exact figure of how what is the exact figure in the country, but then we are a handful of hematologists treating physicians in the country. So with the 30 million of people over here and a handful of hematologists, I think that is grossly inadequate. As Anachal was mentioning about, is the ratio is 1:1 10,000 or something like that. But then this is a worse scenario over here. And then I feel the same problem in other fields of medicines, as in our cancer treating physicians. We do need a kind of a tumor board that we say. That is like the hematologists, treating physicians, oncologists, radiologists, pathologists, and the intensivist. So what happens is, if we do not have input from these people, then maybe we are taking our sole decisions, which may sometimes be inadequate. In fact, it would be inadequate for sure. And sometimes we may be biased. And then also the even though lots of things have come up and a lot of equipments have come into our country. Just to give an example, I have a couple of Hodgkin's lymphoma patients, which are highly curable, lymphomas. So we do have some centers which provide like a PET scan. But then during pandemic, what happened was there was a kind of problem with the reagent, maybe the FTG. So what I had to do is, instead of treating them, I had to send it to the better centers for the proper staging, which is the gold standard. The PET scan is supposed to be the gold standard for the staging work of Hodgkin's lymphoma. So even though they could be treated with a cheap chemotherapy and the treating physician is available, we had to send it all the way because of the lack of the equipment. That's what we face. Number 3, it's a financial constraints. Most of the people, like in Nepal, according to the figure, it's 20% is under the poverty line. Even though in the middle class, if they are diagnosed with the cancers, they cannot afford the treatment, and most of people do not have access to the health insurance. So in this scenario, so when we have to treat a cancer, so sometimes we have to be judicious in doing the tests, because if these patients are not willing for a treatment, or if they cannot afford for a treatment, as this test is very expensive. So we would avoid this testing if they are not going to be treated, just to avoid family being dragged into the streets. Fourth is the important thing is the reliability of the test. It takes weeks and months to get the tests that with the sophisticated that we do it over here. So in doing so we the number one is the time factor. Another is a two-way communication between the treating physicians and the pathologists. So we may feel sometimes these pathologists need the further information of the patients, which is not adequate into the history that we have written. So that is not possible. And even if we do that, it is a kind of a long way process. Somebody writes all the way from there, then we have to answer them. So it is taking time. So what I feel is this communication between the physicians has to be there in proper care of the patient. So when we are sometimes we do have a problem with the flights, the regular scheduled flights. So it does the sample goes all the way via land. And then there is a delay in this reaching the samples over to the center. So probably denature of the sample. Should we just take the result that they have provided? Or should we say that this was a denature? So that is a problem in the kind of a dilemma. So with all these problems, I would say Lymphomap would be the answer for this. As in a future, we say right now we have 60% of the world's population who do have access to the internet, and then that is on a rising trend. So in a near future, people would be able to just log into their app by with their basic demographic and clinical profile and the common lab investigation that do, and then diagnose a case and then see the prognosis in there. So I feel that one day this lymphoma would help us in diagnosing the cases and also guide us in a management in the treatment of the cancer. With these few words, I would thank everyone for listening to me, and then happy Diwali.